Welcome. I'm Molly Hassan, the director of the Eluna Resource Center, and it's an honor to welcome you all to Eluna's community conversation exploring the pandemic's impact on grief. Thank you to Independence Blue Cross for their support of the 2023 Community Conversation Series. Our mission at Eluna is to support children and families impacted by grief and addiction through our three signature programs, Camp Erin, Camp Mariposa, and the Eluna Resource Center. We welcome all of you in attendance today for this important conversation and acknowledge that we're all here because the pandemic has impacted our mental health. It's impacted the way that we perceive the future, and it's impacted the way we hold hope in our hearts. 10 million youth worldwide lost a parent to COVID in the last 3 years. And 400 to 600 people die in the US daily from this pandemic. In addition to this tragic loss of life, the pandemic has significantly disrupted the way in which many of us process and grieve. Although we are slowly stepping back into traditional routines and rituals, we continue to hear from children and families about the long-lasting impacts of the pandemic. We know that there is a pervasive sense of hopelessness amongst young people, and the mental health crisis is in the news every day. At Eluna, we subscribe to the idea that every crisis is an opportunity for profound change. Today's conversation will introduce you to some of these change makers, and it's our hope that their insights will inspire you to become a change maker based on your deepening knowledge of these issues. It is now my honor to welcome back for her second stint as moderator of the community conversation, Kavitha Cardoza, a Washington, D.C. based journalist who has covered children, education, and poverty for the last 2 decades. She is the public editor of the Education Writers Association, coordinates programming for members, and provides individualized help to journalists. Welcome, Kavitha, and thank you for being part of the Eluna family.
Thank you so much, Molly. I'm delighted to be here, and I'm looking forward to a productive conversation where we learn from each other. So before we even get started, I'd like to say, for those of you listening, if you have tips or tricks that have worked for you, please put them in the chat so we can share with each other. I'd like to start off by introducing our panelists. Lamaya Broussard, or rather they're going to introduce themselves, but Lamaya, would you like to begin?
Yes, hello everyone. Thank you, Kavitha. Thank you, Eluna, for having me. Lamaya Broussard. I am a certified trauma-informed senior clinician at Uplift Center for Grieving Children in Philadelphia. And we provide free grief groups to students in the school systems all throughout Philadelphia. And we also provide family services and QTYS, queer and trans youth services, and many other more services. But we believe that no child should grieve alone.
Thank you so much. Catherine Ellard.
Thank you, Kavitha, and thank you, Eluna, for having me here today. My name is Catherine Ellard. I am the COVID-19 Response Program Manager for Tuesday's Children. Tuesday's Children provides a lifetime of healing for families who have been forever changed by terrorism, military conflict, and mass violence.
And our final panelist is Catherine James. Welcome.
Thank you, Kavitha, and thank you, Eluna, for having us today. Catherine James, Senior Director, External Affairs for the COVID Collaborative. I lead the collaborative's Hidden Pain initiative, where we are supporting and identifying children who have lost a parent or a caregiver to the crisis of COVID-19.
So I'd like to start off our conversation with this question. Throughout the grieving process, there are various protective factors or coping skills that support a child as they grieve and adapt. During COVID, this was different. Can each of you talk a little bit about a protective factor you felt was most impacted by the pandemic? Lamaya, I'm going to ask you to kick it off.
Yes. So as we heard earlier in our opening from Molly, we were all forced to pivot and to adapt to survive, and personally as well as organizationally to serve the communities that we work with every day. And at Uplift, we did struggle to find solutions as many others, and adapt according to the new normal initially. But similarly, our students were greatly impacted, and there were just a few protective factors that were mostly impacted for the students that I serve in our school and community area. And that was their ability to neurologically cope. And so students were showing up to group, showing up to school with a very activated nervous system, dysregulated emotions and moods, vulnerable to emotional distress. But parents also was dealing with their own psychological resiliency. And one study showed that nearly 80% of parents reported negative impact of the pandemic on their well-being, and 60% reduced their ability to support their children's mental health. So as we can imagine, this left children feeling very disrupted in their focus, attention, catastrophic thinking. And so this really showed up when they would come to the groups that we had to make now virtual, as everyone did, which was a huge change for us when we, at the time, had 5 locations. 2 out of the 5 in our family services were very new. And so we had to pivot all of the services to virtual. And so the second protective factor in that space that we saw was the age-appropriate socialization. I know one of my other co-panelists will talk a little bit about that, so I'll leave that there. But what I would just share in that regard is that it negatively impacted students' virtual attendance. So they had very low level of mental and emotional capacity to show up in the Zoom school, as we say, and then also stay on after 8 hours or during their free time period to log on for a grief group. And so we saw this show up in our attendance where the minimum amount for students is 6 students. We had to actually merge 2 to 3 schools to just get a minimum. And so that was very new for our organization too, because in the school and community department, we never would merge schools. We did that more in family services, but we had to merge schools to get the minimum. And so that's where we really saw an attendance. And lastly, the sufficient family engagement around the pandemic adapted education process was greatly impacted. Parents were desperately calling Uplift because at the time we had partnered, and I'll talk about this a little later, on our Hope Line, which I am a clinician there, I forgot to add. A free Hope Line providing emotional and grief support and warm handoff for crisis situations. So we were partnering at the time with the school district, so our number was plastered everywhere, but we would have families calling us desperately. We would have employees of the school district leaving voice messages with personal information, trying to navigate this new system. Particularly our non-English speaking families and our immigrant communities really were struggling with how to navigate, what are the instructions they are to follow, how to understand what is to be done. So those were 3 protective factors that we really saw greatly impacted at Uplift.
Mm-hmm. And of course, we know that children, minority children, were disproportionately affected.
Absolutely, and that is majority of who Uplift serves is Black and Brown, as our school district serves majority Black and Latino students.
Mm-hmm. Catherine Jane?
Yeah, so I would say several things. First, we knew at the beginning of the pandemic, especially in some of the hardest hit areas, many children and family were not even able to say goodbye to their caregiver or parent as they passed, as hospitals were not allowing individuals into their units. And secondly, there was not a availability of traditional rites of passage for many of these children. And so, one day their parent may be alive and their next day they weren't, and they were not able to have the traditional family community come together and celebrate that life. And I knew that left many children with a great sense of loss. The second piece that was really kind of disrupted was the access for many that were left behind to the financial and legal system. And when you lose a parent or caregiver, many times it's not obvious that there are Social Security death benefits, that the federal government had a burial reimbursement, especially if the individual that passed was a primary financial provider. All of a sudden, housing and food insecurity becomes an immediate need of these families. And yet the individuals left behind don't know where to necessarily access them. And the legal system is not easy. If in fact the individual left behind is a step parent or a grandparent, they themselves do not have legal authority to get resources for these children. And so they're left with the mirage of how do I get help, and how do I stabilize the child socially and emotionally? And so very disruptive. And we're hoping as we move forward, we can make changes to some of these systems that will better support if in fact another pandemic happens.
I was going to say, at the best of times, Catherine, we know these systems are difficult to navigate.
That's right.
A pandemic, it was probably impossible.
Absolutely, yes.
Catherine, can you talk a little bit about what you saw in terms of protective factors being disrupted?
Sure. So one of the biggest protective factors for grieving children is peer support. And this was something that was hugely absent for many children during the pandemic. Tuesday's Children approach centers around building trust and building a nurturing community. And we have learned with 9/11 and military losses and wide-scale tragedies that people impacted by trauma and loss tend to isolate and not always seek out traditional mental health services, but programs like Tuesday's Children that build community and offer peer support. And these programs have had success in engaging vulnerable groups over the past 2 decades. Before the pandemic, our first contact with families was always something really fun and engaging. We'd go to ball games or do a picnic or have a boat trip. And these programs not only create community, but they build trust and they help us identify the most pressing needs of the families and conduct additional outreach. In the early days of the pandemic, this protective factors, along with all the others mentioned before, were lost overnight. And for families in our network, we were able to pivot quickly to virtual family engagement programs where we did things like touring national parks and meet and greets with athletes, but that peer support element was really difficult to replicate. So we did surveys throughout the pandemic, and they showed us, I don't think anyone would be surprised, that it took a heavy toll on the families that we were already serving. And these were families that have already experienced previous trauma and loss. And at this point, 1 in 5 of our families are now reporting that they've lost another loved one as a result of the pandemic. The vast majority reported a negative impact on their well-being. They were having increased feelings of anxiety, depression, and loneliness. They really wanted that protective factor of peer support and community. So demand for our virtual programs increased dramatically, and 90% of the families say that that did help alleviate their isolation. And luckily, before the pandemic, we piloted a digital e-mentoring program to broaden our reach and reach rural areas and accommodate busy schedules. And this investment really paid off in spades during the pandemic because it filled that gap and met families where they had some peer support needs. But while virtual programming has obviously alleviated a lot of loneliness and isolation, there's still a significant digital divide. So many families across the US are still lacking access to technology to participate in a lot of these virtual programs that so many organizations are offering. And this really impacts rural, low-income, and BIPOC communities. They don't have access to affordable high-speed internet or reliable devices. And a lot of families are dealing with both of those things. So while there's a lot of progress that's been made in restoring peer support and community building protective factors, we have our virtual options, we're slowly coming back to in-person, these communities are still being impacted 3 years into the pandemic.
I think that's such an important point you kind of talked about, because I guess for your organization, it's typical, but to be nimble enough to be able to change programming, that's so important. What do we know? Do we know what the long-term impact will be on those who lost loved ones and their support systems? Because like you said, Catherine, the after effects are going to be with us for years. And so what do you think needs to be done? Catherine Jins?
Thank you. So I think some of the silver linings of the long term are that for sure more people understand the importance of identifying children that are grieving. And schools are becoming more and more aware that grief can materialize in children, and it can look like a lot of behavior issues, a lot of decrease in academic. And in fact, they, through our partners, which the COVID Collaborative has been really grateful for, we've been able to push out a lot of information to schools for them to become better citizens to their students, recognizing that a lot of times it wasn't just students who were grieving, but school personnel were grieving as well over the past few years. So we also recognize that within the school building, as Lamaya and Catherine have said, a lot was going on in the last few years. They were dealing with virtual schooling. They were dealing with additional stress, and the grief of COVID. And so one of the things that we are seeing are schools being able to recognize the grief and then to be able to support the children outside of the school building. So we're not actually adding one more task to teachers that require them to become now, significant grief counselors. We're really excited about what the Biden administration has done with their executive action to really acknowledge that this is an issue. It's a long issue, and it's an issue going forward. And I think the media has done a fantastic job of really shining a spotlight, especially over the last year, to the number of children. We're at 310,000 in the United States that have lost a primary or secondary caregiver. That's only as of September, so there's more coming. But the media has really played an important role for us to let folks know, because when you say that number, many people are still surprised. But as soon as you say that number, they also recognize that we need to support these children. As a good friend, Vicki J, has said, 90% will get through grief and their grief journey with great success if they have some support. And so we just need to find that support and connect those children to it.
Catherine, we've got a comment. Can you repeat that number again?
310,000 children in the United States have lost a primary or secondary caregiver, and that is since the beginning of the pandemic. So that would be roughly April to May of 2020.
And that's not counting parents or caregivers who are affected by things like long COVID, right?
That's correct. That is just the COVID number. That does not include the number of children who in a typical year would lose a parent to cancer, to military service, to being a first-line health provider. So what we saw is about 5 times the number per year of children that lost a parent or caregiver during the COVID years, which we consider kind of 2020 to 2022. And that's compared to a traditional year.
Lamaya, what are you seeing and what are you kind of anticipating in terms of long-term impact?
Yeah, so we know that we are continuing to see the impacts of long-term effects of COVID-19, with mental health challenges being one of the most prevalent. We have yet to know how much this is going to impact, but there was a study done by a clinical epidemiologist at the School of Medicine in St. Louis that stated COVID-19 infections likely have contributed to more than 14.8 million new cases of mental health disorders worldwide and 2.8 million in the US. And so with that being said, we know that it's very real with mental health challenges that are existing. However, what we do know is that the mental health social determinants have now changed and are ever evolving. Now we see in mental health that is impacting across all socioeconomic statuses, across all persons, even with robust social supports, full lives, that are very engaged and active with their community, live in environments that are both underserved and overserved, that are dealing with, suicidal ideations, depression, anxiety, suicidal attempts, as well as substance abuse substance use is all happening. And those are all actually we're seeing like an increase of that. And even we know that research have showed, according to the American Academy of Pediatrics and American Academy of Child and Adolescent Psychology and the Children's Hospital Association, in February and March of 2021, that ER visits for suicidal attempts among girls ages 12 to 17 increased 51% in comparison to the period in 2019. And then more data that even shows that, you know, pandemic-related decline in child and adolescents has also shown in emergency visits. So what we've seen is that this is also something that definitely needs to be addressed. We need to reduce mental health barriers to learning. This is a reality that many of our students are facing. And again, grief and the uncertainty of what is going to happen in the future has exacerbated this. And so we have seen, like in our city, the School District of Philadelphia, February 2021, actually now is providing free, you know, mental health services to all high school students. There are also services that are available and accommodating even to the community in terms of the school district staff, you know, but we know that those services are there and in place, but we still need to make sure that it's realistically able to be used. We've also seen some of the learning and life disruptions that occurred, you know, going back into the schools, doing groups, and counselors informing me that a lot of their juniors and seniors dropped out. They were right at the cusp of graduation, but they could not adapt back to being in school while still grieving, while still managing, while trying to cope with all of their emotions. During the pandemic, we saw on our Hope Lines a lot of high achievers were struggling majorly academically. Parents calling, caregivers calling, needed support because, you know, a lot of the high achievers, their identity was abruptly, you know, diminished, changed, where they were used to, you know, receiving a lot of the confidence and a lot of the certainty through their academic performance, and that had completely changed and shifted. So we need to be more considerate and sensitive to this reality. And then lastly, we've seen some unrealistic and inequitable expectations for our BIPOC communities. You know, several families, as we've heard, you know, I've heard from some of my other co-panelists speak about this, but several of our families are families who had to move in the pandemic, but they were still virtual. And so they were using the address. And once they came into person and the parents, you know, had to weigh between getting the child to school on time or getting to this job, or trying to do both, and students sometimes had to miss or was late, and now you had truancy being involved, and so now at risk of truancy. Some of our immigrant families were at risk of immigration involvement, you know, taking phone calls. I remember a call that came in from a student from Central America and who had immigrated here, and in order, you know, for his immigration status to be secure, he had to be in school. And so if he wasn't in school, but he was struggling in school, as everyone, you know, was, a lot of students. And so if he dropped out of school, then in turn, his immigration status could be impacted. And so these are also some of the pandemic sensitive, you know, things that we would like to see versus punitive, that we have to understand that families and students are still recuperating, still recovering, and some have yet to be seen.
Catherine, I'm curious about what you are preparing for in terms of long-term effects.
So at Tuesday's Children, we often talk about ripple effects, and that's really how we define the breadth of our response to 9/11 and to the long-term needs of other communities that we've worked with over the past 22 years. Every tragedy has a unique scope and different ripple effects, and there are underserved groups that emerge. Some emerge immediately and some emerge sometime later. And right now we're living in the midst of the COVID-19 crisis, in which we've lost, I believe, more than 7 million people worldwide, over 1 million in the US. And as Catherine mentioned before, 310,000 children have now lost a parent or caregiver. Many lost their sole caregiver. We've already witnessed some of the ripple effects of COVID in mental health, as a lot of us have touched on already, education, the economy. Some ripple effects of this tragedy are yet to be determined. One thing we know very well at Tuesday's Children is that grief rides developmental waves and it changes with life milestones and reminders. And that's why long-term support is so essential for families. Children who lose a parent at a young age, they may not fully comprehend the finality of death, and they'll likely re-grieve as they reach new milestones or transition to a new school, observe a milestone birthday, experience any first that you would want to have your special person to be there with you. So all of us on this call and this session, those in the audience, we can better support them through those painful reminders. To highlight another ripple effect of COVID, as we've seen in the past, tragedy really does fuel innovation. And for Tuesday's Children, our pivot to virtual programs was successful because we were able to deliver a greater number of programs and introduce new programs while serving more families and keeping costs low. And we were increasing our geographic reach. So it's one of those silver linings that Catherine touched on. And as we approach year 3 of the pandemic, I think we're going to witness a lot more innovation and reimagining of what community looks like, what community support looks like. I'm sure a lot of people are pleased to see that there is a return to in-person programming, and I'm sure others are more excited that they have more access through virtual programming. And I think we'll continue to see this kind of hybrid of community support, which is ensuring that many families are reached and more connections are made.
Mm-hmm. Mm-hmm. One of the things that surprised me greatly was learning that there is a lot of stigma involved when it comes to COVID deaths and COVID grieving. I want to start with you, Catherine. Why?
So more and more with COVID losses, we're hearing from both families and the partners that we work with that many are experiencing something called disenfranchised grief. And this is when people are feeling that their loss is not being openly acknowledged or publicly mourned. Many families are also hesitant to self-identify because they may not have had an opportunity to connect with any other families who have experienced COVID grief. And there are multiple factors that are contributing to this. It was mentioned before, the lack of in-person funerals, rituals, and celebration of life. There is no official COVID Memorial Day. There are a few local things that pop up from city to city, but there's nothing that's official in the United States. There's no physical COVID memorial for families and mourners to visit. And of course, the big one is the stigmatization and politicization surrounding COVID and COVID deaths, making grief even more painful and isolating. People who have experienced COVID loss sometimes feel like they can't even openly express their loss because of the stigma and of how their loved one died. And they really sometimes feel that others will judge them based on their loved one's personal choices, their health, their lifestyle, getting questions like, did they have a pre-existing condition, or were they vaccinated or unvaccinated? And a major ripple effect of disenfranchised grief and families not feeling validated in their loss has led to a lot of barriers in identifying those who have experienced losses due to COVID. So part of the work that we do in our COVID response program is building the bereavement support capacity of the sectors that are going to interface with kids and their families on a daily basis. So these are sectors like healthcare, education, community-based organizations, faith-based organizations, and even corporate workplaces. And what we have found in our conversations with representatives from all of these sectors is that everyone's really experiencing the same challenge, which is finding COVID bereaved youth and their families and connecting them to their services. So Ken Doka, who coined the term disenfranchised grief, actually found in his research that this type of grief can make people more likely to question themselves, question their grief, isolate themselves, and experience depression. So it's making it all the more crucial that we reach those impacted by COVID loss.
Because they're not even sure that their grief is valid.
Right.
Lamaya, I saw you nodding a lot when Catherine was speaking, and have you seen this too in your work with children?
Yeah, especially the disenfranchised grief. You know, in order to preemptively address the anticipated stigma and stereotypes, what we've been able to do at Uplift that I've been so grateful for and has been very conducive and beneficial for our students is we've been able to apply Ambiguous loss is a type of loss that is not like a physical death, but it can be psychologically, that person have died psychologically, or their presence is absent, but you're still connected to them psychologically, or vice versa.
Give me an example, Lamaya.
Yes, I was just going there. So what we had to do before the pandemic, we work with a lot of our queer and trans youth communities. And so for a lot of them, the relationships have been severed because of how they identify. And so many of those persons are considered dead, to a lot of the youth. And so we had to expand. Yes, Uplift, definitely. We are an organization that works with families and students who have experienced and lost through death. However, to be culturally responsive, we have also been inclusive when serving our queer and trans communities, been able to also include ambiguous loss, the loss of, of just even the closeness that they had with that family member, the loss of their security. And so we've been able to apply that now in openings at every group that starts. We are now able to introduce the concept of ambiguous loss, explaining to the students that we understand that we are all here, including the facilitators such as myself, because we've had someone die in our life. But we also know, because of the pandemic, many of our students, it's like a trifold effect, that they were dealing with the pandemic losses, dealing with George Floyd being publicly murdered, with police brutality. I was literally doing a group online when the Capitol riots was occurring. So it was a lot of disenfranchised grief around that, feeling like, wait a minute, our grief is not validated because now we're dealing with racial and systemic injustices. And so a lot of, developmentally, our students may not be able to come out and say, hi, I am here and I am dealing with the grief, an ambiguous loss around having to see my family member hospitalized for weeks, not being able to go into the room, or, not being able to cognitively communicate with my family member since COVID. And this is really impacting me. However, when you set the tone and you open up the groups in a compassionate and a inclusive way of the other losses, we have seen how much of a benefit just being able to mention those losses has really helped. This was also seen as important because when we did our data, we saw last year that the second leading cause of death for many of our students was illness. And so then we were able to, as looking at our permission slips that we obtained from the caregivers, even though it wasn't explicitly saying that they died of COVID, we were able to assume that this was COVID because all of the other descriptives was related to a lot of pandemic deaths. And so we saw the stigmas through our permission slips. And that's why, again, we wanted to make sure that we can destigmatize by acknowledging and validating the many losses that may not even be expressed verbally. And then now, though, I'm also seeing, now that we're on this side of it, I am also seeing the other side where I'm having some, especially younger kids who family have not informed them that the caregiver died of substance abuse. They told them it was COVID instead. And so I'm seeing kind of the twofold now, and many of, our students, they're dealing with so much of invalidated grief that it kind of takes on a different form. In comparison to some who may not be disproportionately affected. And so we're seeing it that way. And then even in some organizational work I also do, in addition to Uplift, outside of Uplift, we have had to totally reframe the narrative to destigmatize mental health and pandemic related losses. And some of that has been using the terminology that was promoted and encouraged from Association of Black Psychologists, to let's have courageous healing conversations. How about we come and have courageous healing conversations around different losses we're experiencing? How even, let's do some body-based work to see how our grief from pandemic losses is actually manifesting in our bodies, and seeing how changing the language has helped significantly with a lot of our BIPOC communities, being able to express and identify and provide psychoeducation. We've seen that go a long way. So that's some of the ways that we've addressed the stigma.
Mm-hmm. I love that. Just changing the narrative. like just goes from something which kind of feels empowering and feels like you're supported and feels like very hopeful.
Absolutely.
I really am so surprised though that children would, even though they're children, they know their stigma attached and they will not write down what the reason is. I mean, that just feels so much of a burden for them to bear. You know, on top of the loss, they're wondering how to frame that so it's acceptable.
Exactly.
Catherine, I'm wondering if you could talk a little bit about what you were seeing.
Sure, thank you. And this just really builds on what Catherine and Lamaya have said, but the pandemic isn't over. We're still losing 400 to 500 individuals every single day. And those individuals, in the most part, have family members and children that will continue to grieve. And so while most of the country would like to move on, we still will be dealing with this, to Catherine's ripple effect, for years and years to come. And so one of the things that's most disheartening is we heard anecdotally that many children were bullied in school, especially around the time when the vaccines were becoming prevalent. Was your parent vaccinated? Were they not vaccinated? That was very much associated with where they lived. Were they in a state that was open to COVID and the science that behind COVID, or were they in states that it was not? Were their parents, to Catherine's earlier point, did they have comorbidities that all of a sudden they were unhealthy to begin with and they should have done something different? So we really saw that children were afraid to tell folks that, yes, my parent has lost or has been lost. And while we know there's no way to identify children, and I'll talk about that in a minute, but there is no way in the United States to identify a child that has lost a parent or a caregiver. And that's at the federal, state, or local community level. And so one of the things that we're going to do going forward is really try and change that. So schools, when a child walks into a school, that school knows that child is grieving, and we don't have to rely on that child to raise their hand and say, in fact, you know, I'm one of those individuals that has lost a parent or a caregiver. And then to Lamaya's point about reframing the conversation, I think one of the things that we are doing actively as we try and come out of this pandemic is really take the work that's been done in the pandemic and all the things that we've learned in the pandemic and communicate to the country that this is, in fact, something that needs to be present in all schools and communities, because children will lose parents and caregivers to so many different reasons. And that what we can build because of COVID easily translates to whether it's the loss from military service, loss from illness, loss from frontline workers. And so for us, this was a wedge issue to really bring attention to the great work our partners are doing to help schools and communities and governments understand the impact that they can have in order to support children.
We're starting to get questions come in, which is great. But I do have a couple more of my own. Like you said, there are people dying, hundreds of people dying every single day. How can caregivers and professionals help support grieving families? Lamaya, would you like to start?
Sure. As we relate, are we looking at what now? Are we referring to
yes.
What we can do? Absolutely. Yes. So organizationally, you know, Uplift has consistently innovated our practices. As I heard one of the Catherines mention, that innovative, it leads us there, right? To be innovative and responsive. And so we have seen this through our Philly Hope Line. And so our Philly Hope Line came into inception May 2020. We actually won the Greater Philadelphia Social Innovation Award. And so we came into existence to be able to provide, again, direct response to COVID and be able to provide that emotional, that grief support And this is a number that is accessible to anyone nationally. It primarily, is for Philadelphia school students, but students can call, caregivers can call, teachers can call. And what we've done is we restructured the Hope Line to not only address those areas, but to now be able to be where caregivers or anyone can call and do an intake for our family services. So our family services provides 5 cycles of 5-week free groups that are running throughout the year, and that even if you finish a cycle, you can rejoin again and again. And although we're virtual right now, we're slowly getting to the in-person. We do offer 5 in-person time to come together, but we have innovated in including resilient parenting, our come together groups where you have our queer and trans community come to a group with the caregiver that they trust. School and community been able to provide groups now to some that have been on the wait list, brand new schools to groups, but we've been able to, since our inception of the Hope Line, we've received 1,367 calls, 2,699 minutes, and then the average length about 15-minute calls. But since July, when we included the intakes to come in, we have already completed July of 2022, 365 intakes. So we average about 46 intakes a month. So we have seen the increase and being able to provide and have this Hope Line, which I saw the information shared, but we have bilingual hours, we have queer and trans hours, we have regular hours. So that's one thing that we have done from this point and continue to innovate in that area. And secondly, as a clinician, being more school, home, and community connection interventions, really promoting those, partnering with our counselors, and being able to advocate for schools to be more grief and trauma informed, allowing teachers brain breaks. Teachers, when you are in schools and you are in survival mode, again, on paper, it's a lot of services that's there, but you may not realistically have the opportunity to step aside and take a brain break for your own emotional and mental wellness. But lastly, being able to expand our grief awareness and competence through trainings of our teachers, of our community partners, and working with schools to help, instead of students being, behavioral issues impacting them coming to group, even if they're suspended, that they're still allowed to come to grief group. So that's something as a clinician we've been talking about, because some behaviors that you're seeing is actually common grief responses. And so we would like to see some more of that occur. And so that's some of the things that we've been able to do. But yes, our Hope Line, Philly Hope Line, is available Monday through Thursday, 10 a.m. to 8 p.m., Fridays, 1 p.m. to 4 p.m. And I know the number and everything will be in the resources. So that's some of the things that we've been able to do.
Mm-hmm. That's great. And I love that it's called a Hope Line and not a helpline.
Yes, we were very intentional about that, Kavita. I'm glad you connected that.
Yeah, reframing the narrative.
Yes.
Catherine, what do you suggest to support what do you suggest professionals can do to support families? Sorry, Catherine Ellard.
Okay. So there are a few things that set the pandemic apart from previous mass tragedies and disasters. So for one, I mentioned before, there's no set anniversary or milestone acknowledged or shared across the US. Some families may be coming up on a 3-year anniversary, while others may be just a few months post-loss. And I think this contributes to a lack of a larger cohesive community, unlike what we witnessed after 9/11, when the entire country united to support the families that lost a loved one that day. And one of the lessons that we learned working with families in the more than 2 decades following 9/11 is that communities need long-term commitment and response, and understanding that traumatic events have a lifelong impact on children and their families, and that those needs are going to change over time. So through our COVID-19 response program, we're working on absorbing that impact by creating communities, and we're doing that by building capacity. First by increasing the knowledge of long-term needs of those impacted by trauma and loss. And then we're going to train key service providers so that they're ready to address those needs when the families are ready to seek out those services. And I think another important step moving forward is to destigmatize COVID, which we all talked about previously. And we're going to aim to do that through education and awareness. And as part of our grant, we're working on forming a COVID Youth Council, which will be modeled after a Tuesday's Children existing program called Survivors of Tragedy Outreach Program. And this is a coalition that offers survivor to survivor peer support from individuals that were directly impacted by or responded to terrorism, mass violence, and military conflict. So the Stop COVID Youth Council will also serve as a peer support coalition, but it's also going to create opportunities for public awareness campaigns and media around addressing pandemic bereavement in children, and be a resource for community resilience. It's going to help identify gaps in service and effective strategies for engaging and supporting bereaved youth. And it's our hope that these programs and resources will play a much needed role in protecting the well-being and promoting the long-term healing for COVID bereaved children and their families.
Catherine?
No, thank you. So the collaborative, I think we, as we enter 2023, really have a three-pronged approach. First, we want to keep awareness of the situation. We want to make sure that folks know, like I've said before, there's a significant number of children across the country that have been impacted by COVID. But we also want to do some things that specifically will get at identifying children. Number one, we know that Brazil has implemented a checkbox on death certificates. And so once an individual passes, that checkbox is marked if there's a child remaining in the home under the age of 18. We think that's something very simple that could be done across the United States. And that's something, as we look at all of the solutions to identification, one of the first and foremost is protecting the privacy and rights of anybody that is left, either the caregiver or the child. And so as we think through these alternatives and options, we want to make sure that that's first and foremost in our ideas. The second is potentially thinking about a checkbox on back to school forms. Most parents have to fill out a ton of forms. And what we've learned from Catherine at Tuesday's Children with 9/11 is that every time a child has to restate that they have lost a parent or caregiver, it's just re-traumatizing. So can we not find ways in the school system with a lot of the electronic records that are being kept that the parent or guardian can just check once? And then that would notify the school that this child has lost and may be experiencing grief. And then finally, one of the things that we're most excited about, we were made aware of an effort in Allegheny County in response to the opioid crisis to match administrative data records that for death records and birth records to say how many children were orphaned at a single point in time due to the opioid crisis. With the generous support of New York Life Foundation, we are launching a pilot in Utah where we're going to do just that. We're going to identify children based on not only death and birth records, but potentially also workforce development records, so we know who's claimed as a dependent, but then do that more often than yearly so that we can then create a backbone structure, whether it's through their 211, but have a government agency reach out to these families to say, we recognize that a loss may be happening or have happened, and here are all the resources that are available to you as an opt-in. And if they do opt in, then we can connect them with a great wide range of resources. And hopefully by connecting them, we can then improve their outcomes over the long term. And so we're really excited about the momentum that we have. We're open to other ideas as we think about how to identify kids. But once we look outside of the traditional mechanisms at the community level, we really think that it's a role for local, state, and federal agencies to get involved.
Mm-hmm. I have a quick question. As a child tells the story of their loss, is it important or essential that they identify the cause of death of their loved one? Or is it okay just to label it as loss? Anyone can jump in. Lamaya?
I was going to say, I know on our permission slips that goes to, unless you're 14 or older, it goes to the caregiver. We have a section where we say, how did the person die? They can complete this if they want. We're all about choice. But then we also say, do the child know how the person died? And so, research, definitely we encourage to have honest, age-appropriate conversations with children around death. Be mindful if we're more uncomfortable, then we feel the child is uncomfortable. But we respect. If we read a permission slip and the child doesn't know, we never say, well, no, this is actually how they died. But we allow the families to be able to identify that if they're comfortable, and always ask, do the child know as well? And then the caregiver will put, what they do know. But generally, the more, again, honest and age-appropriate way that you are in explaining the death to a child, the better it is for their grief.
Anyone else wants to jump in, or?
I agree with Lamaya. I think you should never force anyone to reveal any information that they're not comfortable revealing. But at part of your long-term healing and post-traumatic growth, I think it would be important at some point to be able to identify it. But I don't think anyone should ever be forced into giving up information.
Another question, and we've seen this in other instances, children feel responsible for the grief in their family or the tragedy in their family. How do you help them reframe that or understand that as not their fault? Catherine?
Well, yeah, I would go to Lamaya. I am not.
I was going to say Catherine.
Outside my wheelhouse.
Okay. We actually, in Tuesday's Children, we have quarterly speaker series, and we recently had one on how to cope around anniversaries and milestones. And we had Julie Capello speaking, and she was talking about some of the clinical things that she was doing with children of parents who had been lost to COVID. And she said in one of her sessions that the child actually said to her that she felt that she had killed her mother. And I'm not a clinician, so I don't think I could really delve too deep into that, but I think it just goes to show how children are feeling at this time, and how they do feel guilty that they feel like they brought COVID into their home. But I would defer to Lamaya also about how to do that, since she's the clinical side of things.
Sure. So it ties into what was said a little bit of how I just answered the other question. That first of all, guilt is a very common grief emotion. We brainstorm every cycle. We do a feelings brainstorm. Guilt inevitably comes up from all ages. And so a couple things with that is, one, it goes back again to having that age appropriate, honest conversation with the child about the death. If someone dies of COVID, being able to explain, that daddy died from an illness that can cause our body to stop working. And so having to explain that, so then that child's not feeling, well, I'm sick, am I going to die? But being able to explain that in age appropriate language is always helpful. And so it is not your fault. It can feel that way, but it is not, you did not cause it. It's the illness that caused it. And so being able to explain that to a child and normalizing that guilt is very common. Another component, a grief expert, and I forget the name at the top of my head, talked about too, that even guilt is a way that our brain a lot of times tries to process the feelings of helplessness and hopelessness. So when we feel helpless, sometimes we will go to that guilt feeling. We also have to remember, depending on if it's adolescence, you're egocentric by nature, developmentally. And so you naturally own and take things on as it's your fault, it's you. But what we also like to summarize and kind of say in group, unless you physically or intentionally cause someone to die, it's never your fault, but it can feel like your fault. And so we just kind of work through that by honoring that. And so that's the way we address it usually.
I have to hand back the mic to Eluna in like about 2 minutes, but I wanted to quickly go around and again ask you all There are a lot of professionals and people who help grieving families. And I think from just interviewing them, I have found that they rarely think about themselves. This is a profession people go into because they want to help others. How do they make sure that they are doing okay? If we could maybe start with Lamaya, 30 seconds each.
Okay. How as a professional, you're okay?
Yes. A professional, a person, we talk about
Okay.
making sure parents are okay and teachers are okay and children are okay. How can we make sure we are okay to do this work?
Yes. So one thing I have to give a major shout out to my organization. We just updated our policy because we are a grief organization to where we are now able to take unlimited bereavement. And so many of us have had someone, including myself. My mom died during the pandemic, not from COVID, but during the pandemic in Louisiana, where, it was high numbers. And so that wasn't implemented then, but it still was a lot of that compassion and grace around the bereavement. So I know not everyone have that opportunity, but if some organizations could consider that specifically for those working in grief day in and day out, because we do get impacted. We are human. And if we are actively grieving, it is difficult for us to support someone who's grieving. And so I would say consider that. And then secondly, understanding that grief certainly comes in waves. And grief, as we define it at Uplift, are all of the thoughts, feelings, and behaviors that happens to someone after someone dies. That can manifest in many different ways. And so understanding that any thoughts, feelings, or emotions or behaviors you're feeling less or more of since that person died, that most likely is grief. And so being aware of that and then being able to share what it is you need.
Catherine Ellard?
I love what Lamaya said earlier about giving teachers brain breaks. I think we all need brain breaks from time to time. I think having support systems, of course, within your job and your work, which I can say Tuesday's Children is a wonderful support system, but having them outside of work as well and having things that you can escape to. For me, it's anything active, yoga, hiking, just, getting outside, leaving kind of the work behind for a little while and having your little brain break is always something that works for me.
And Catherine?
I think for us, it's really around raising awareness so that individuals both in the workplace and schools and communities can be compassionate and understand everything that Lamaya and Catherine have said. Grief is not instant. Grief can come at any point. And to have individuals that you can go to and say, I need a brain break or I need a few days off, it's now hitting me. It might have been a month, it could have been a year, but the more compassion and the smarter we can all become around what grief looks like, both for children and for adults, I think the better off we will be.
Thank you so much. This has been such a great conversation. I'm so grateful to be part of it, and I'm going to hand it off to Stacy from Eluna.
All right. Thank you so much, Kavitha. Thank you so much, Catherine, Lamaya, Catherine, for sharing your expertise and wisdom today. This critical conversation is presented by Independence Blue Cross, so thank you. And also our COVID grief resources that we've developed at Eluna wouldn't be possible without the partnership and support of the Brave of Heart Fund, which is founded by the foundations of New York Life and Cigna and administered by E4E Relief. We also want to thank Eluna donors, supporters, ensuring that we can provide our resources and camps free of charge. If you are new to Eluna, welcome. And we also invite you to support us by sharing the recorded conversation of this with your own network. I will now be dropping our survey link in the chat to help us inform our future conversations and provide feedback. So please fill that out. Thank you. And also keep an eye out for our follow-up email coming soon that will include the video recording, survey, and helpful resources. So I'd now like to pass it off quickly to Kelly, who's our amazing Camp Erin online programs manager. She's going to share about our upcoming grief workshops and support groups.
Thanks so much, Sarah. What a wonderful conversation. I won't take too much of your time, but just wanted to share that Eluna did launch our first ever direct support programming in 2022. And just like our traditional Camp Aaron programming, Camp Aaron Online is free, and it is for youth and families grieving the death of a significant person in their lives. Participants will attend online experiences, so these are available nationally. Our goal is to provide a safe environment for participants to explore their grief, learn essential coping skills, and experience community with other families who are also grieving. We have several programs coming up. Ms. Sarah is going to put the link in the chat for all of the great information, but please share. We would love to have families join us for a painting workshop on May the 20th, a mindfulness and movement opportunity specifically for teens and young adults on October 7th. And in addition, we are also launching our online family support group called Grief Compass Groups. This is just going to be a drop-in touch point opportunity for families to come and check in and learn ways to navigate their grief and connect with others who have experienced loss. So more information can be found on our websites, and we are so grateful for you joining us today.